Good evening to all of you, the organizers, the planners, the sponsors, and the attendees of this conference. Ladies and gentlemen, sisters and brothers, first let me welcome all of you to this very important conference and say to you that I am both honored and humbled at the recognition that you have bestowed upon me. I am deeply disturbed that I am not able to be with you, but at this point, the press of my job as mayor of Oakland requires that I be here. So I mean no disrespect. I had no idea that at this late stage in my life, as I have just turned 75, that I would be the mayor of Oakland. But when people asked me to do this, I responded to a call to service and decided that it was terribly important that as mayor, we do something about the HIV/AIDS pandemic that not only was hitting Oakland, the Bay Area, the country, but the entire planet. And in my capacity as a member of Congress, in my role as chair of the President's Advisory Council on HIV and AIDS, and in the various consultative roles as I went about the country and the world to talk about innovative, collaborative efforts in solving the HIV/AIDS pandemic. All that came together as mayor of Oakland. I remember going to Africa with then HHS Secretary Tommy Thompson. We went to Botswana, and I remember this wonderful woman. She was the health minister of Botswana. She got up and talked to a large gathering of people and indicated that she had tested herself for, she had gotten tested for HIV. And I turned to the people with me and I said, what a powerful statement of a public servant in this moment of controversy to stand up and say, this is a disease that can be prevented and that testing can go a long way toward that once one understands one's status. Well, I awakened one morning and I was the mayor of Oakland. And I got myself tested on City Hall steps, and there we launched Get Screened Oakland, based on the simple idea that HIV and AIDS is a preventive disease, and that if people know their status and from that are able to get care if necessary, is a very important blow at one of the most dangerous pandemics to address the human condition in my lifetime. We know that it is unfinished business, as more than 50,000 new cases of HIV are the reality annually in this country. And though we've had a drop globally of 20%, there are still too many people, somewhere around 2.6 million new infections a year. So we have a job to do and have to continue to do it. My hope is that people will take example in this country from what we've done with Get Screened Oakland, and that they will take advantage of it in other cities around the world to do so. In Oakland, we say instead of thinking globally and acting locally, we say think locally and act globally. So we hope to export this to other places. Our hope is that other public officials, other mayors will allow themselves to be tested publicly, become the outspoken voice of a pandemic that threatens the human condition in extraordinary ways. So we've got a long ways to go. I am grateful to have played some very small role, and hopefully will continue to play some role in continuing this struggle. Again, I am terribly sorry that I could not be with you this evening, but thank you for this extraordinary honor. We have much work to do, and I hope to meet you down the line as we continue to address these problems. Good night, and thank you, my sisters and brothers. You have honored and humbled me.